Hi everyone, welcome again into another session of our podcast. And in this session of our podcast, we are going to be talking about the management of diabetes mellitus. And remember, in our last session, we had Dr. Kimonia Awanchiri Bir, who promised that she was going to come again to talk to us about the management of diabetes. So welcome again into this episode.
Thank you.
Yeah. So we are very happy that you are back again to talk to us about the management of diabetes. So, what is the very most important first step in the management of diabetes mellitus?
Okay, so the most important first step, which is most important because it doesn't have any side effects, and it's what we also recommend to people who have not yet developed diabetes, maybe who are pre-diabetic, and we recommend that they should do these things to prevent progression to diabetes. And it's also what we recommend for people who have stage 1 of diabetes, so like not very high blood sugars. We'll try all of these things before we start putting them on medication, because medications have side effects, right? So which we are talking about lifestyle modification here, and the three main things that we will discuss, we'll talk about diet, we'll talk about weight loss, and physical activity. So basically it's just the general things of like controlling what we eat. Controlling what we eat is very important. We have to eat like the right portions, the right amount of food. We're not saying that people should starve, it's just about eating the right portions of food and the right amount of food. And the rule of thumb is ensuring that each time you're eating, you can divide your plate into four. So a quarter should be carbohydrates, another quarter should be protein, another quarter should be the healthy fats and oil, and then the other quarter it's vegetables with fruits. So you just have to have this in mind every time you're eating, so that instead of filling a plate with rice, that's 2/3 of the plate with rice, and then a little bit of beans, which is a protein, which is good, you remember that the carbohydrate just has to be a quarter of the portion of what you're eating every time. Now, physical activity, we remember that physical activity is important for every reason, right? But then for it to count, you have to really feel your body temperature increase, and you have to feel your heart raise more than it. You have to feel your heart raise, so your heartbeat has to be more than the way it is when you're resting, right? So maybe just mild walking may not really count if you don't feel your body heat up, and if you don't feel your heart racing. So if you're doing walking, you'll have to exercise longer than somebody who is actually doing some intense exercise, and it's recommended that we exercise at least 30 minutes every day. Yeah. And then weight loss, everything that you can do to lose weight, but of course trying to lose weight the right way, not starving yourself and eating the right things, physical activity and all of that. Now the other things is like stopping smoking. In case you smoke, you have to stop it. If you take alcohol, you try to reduce it as much as possible. For men, at most 2 drinks per day, and 2 drinks means like 2 small beers or 2 glasses of wine per day. And then for women, 1 small drink, 1 small beer, or 1 small glass of wine. But if you can stop drinking altogether, it's even great.
Yeah, thank you so much. And when you talk of lifestyle modifications, it's so important, and very important also is the fact that you mentioned exercising for about 30 minutes a day, which many people sometimes think that when you say exercise, it means that they have to run like the people that are running the mountain race in Korea. But you have made us to understand that just exercising 30 minutes is enough a day. And I don't know, would you want to specify lifestyle modifications, and also how it may have an impact on the type of diabetes?
Okay, so regarding the type of diabetes, lifestyle modification, the general rule or the general recommendation for lifestyle modification really applies for everyone. But then for people with diabetes, it's even more important for them to remember that they don't have to starve, because your body actually needs the food that you take, right? Your body needs this glucose. That's why it's actually the medication we give helps your body to use up the glucose, but starving is not a solution. You actually need to eat, especially when you're diabetic and you're taking medication.
Yes, really it's interesting to emphasize that starving is not the solution. And this takes me to think about the common things that questions that patients would ask us. Um, am I supposed to eat sugar? Am I supposed to take honey? What should I not eat? Things like that. These are repeated questions that people always want to draw a clear line on it, and it's so important. Maybe you want to say something about that.
Yeah, so drawing a clear line may be a bit tricky, but the one thing that I'll talk about is the fact that you see many diabetics come up to you saying that, oh, they've been asked not to eat fruits because they are sweet, or they've been asked not to eat sweet potatoes because they are sweet. That is where there is a problem, and that's where we need to draw the line. So I'm saying we need to draw the line because there's a lot of misinformation, which is really not the best. And it's true that if you are working with nutritionists, they may give you certain restrictions over a certain period of time with good reason, right? But then again, the general rule is that you need to eat what's nutritious, right? We just need to avoid what we call empty calories. So empty calories are basically taking foods that would give you calories, would give you energy, but then they have no nutritional value and they are not adding any benefit to your life. So when you're talking about feeding, you have to think about both things. You have to look at the calories. We're not just looking at calories, we're not just counting calories. We have to look at the fact that what we are taking is giving us calories, which is the energy that we need to carry out our daily activities. And we have to ensure that it has nutritional value. So I'll give a simple example. Let's say taking a bottle of top, right? A bottle of top, and then eating some oranges. Now the difference is that top is empty calories. It's going to give you sugar, refined sugar, which just provides you energy for that day, right? And it's a lot more sugar than you would find in natural fruits. And the added advantage with the natural fruits is that it has nutritional value. It has minerals that your body needs to fight disease. It has vitamins. It has antioxidants that your body needs to fight disease, and it has many things that help you build your immune system. I'm not saying it doesn't have sugar, but it does have sugar, which your body also needs. So it has sugar in the best form of sugar that your body would require, right? Which is fructose, and in a simple form. And also because these fruits and these other kinds of whole foods have fiber, the body is going to absorb the sugar from the gut at a slower rate than if you were taking maybe a bottle of juice. Your body will just, take up the sugar as soon as possible, and before you know it, you're feeling hungry, and you've not added any nutritional value to your body, by taking a bottle of soda, by taking highly refined foods like maybe biscuits, cakes, and all of these things. It's true that a biscuit may be as sweet as a sweet orange, right? It may be as sweet as pawpaw, but remember, this pawpaw has sugar in a very in a basic form, which is fructose, which is good for your body. But then this biscuit has sugar in a very refined form. This fruit has less sugar, regardless how sweet it is, but this other refined thing has a lot more sugar. This fruit has minerals, vitamins, fiber, which your body needs, but this other refined thing doesn't have all of those added benefits, but then it has oil, which is bad for you, and it has other lots of fat, which is not good for you. So if you can just think in that way when you're talking about feeding, you remember to you know the things to avoid and the things not to avoid, as a general rule.
This is so important. Really, the natural foods are so good for everyone, and things it's not necessary to starve. This is an important message that I think that in the simplest form our audience have understood it so well, and we would really be also keen to understand from you. Once somebody is diagnosed with diabetes, you start the person on a management strategy. There is always this question, like we have spoken about lifestyle modifications. Does it end there? Is there something else that is supposed to be done, like drugs, like things like that, and things like that? So
Yeah, definitely. So most likely people who are diagnosed with diabetes would end up needing medication. But if you're very lucky, and again we get it when it's really really early or in the pre-diabetic phase, and you are able to adhere to the lifestyle modification, you may not need drugs. But oftentimes you need medication, and you would likely take the medication throughout your life, right? So we have oral medication, and then we also have injectables, and the oral medications act differently. That's why sometimes you see somebody taking one or two or three different kinds of medications, right? The most common one is metformin, and the way metformin works is that first of all, it helps the body's cells to pick up the glucose. So it increases the way that the body uses insulin. The body cells uses insulin to take up the glucose, and it also reduces the rate at which glucose is being released by the liver. Now there are other drugs that act differently. Some drugs act by helping the pancreas to produce more insulin. Now in case your kind of diabetes is the one where your pancreas cannot produce insulin, or your pancreas cannot be helped to produce insulin, then you definitely need insulin. That's why you find some people with diabetes having to inject themselves with insulin constantly, because the body needs insulin to be able to take glucose into the cells. Yeah.
Okay, thank you. I understand you have talked about maybe drugs in two ways. The ones that with tablets or things like that patients can take, and you have also spoken about the ones that are injectables, which the choice of these drugs now would depend on how severe the situation is in each individual. And that is really interesting to know. And I think that this particular point takes us to understanding that there is uniqueness in management, and even when there is uniqueness in management, there is also a chance of, let me use, titrating, like measuring if things are going well and so on and so forth. Maybe you may want to reduce the tablets, you may want to now stop the injections and things like that. So I think this goes with maybe an ongoing follow-up.
Yeah.
So can you throw more light on an ongoing follow-up strategy?
Yes, so that's very important, because people with diabetes need ongoing follow-up. They need continuous evaluation. They need continuous monitoring, and it goes beyond just checking the blood sugar. First of all, we need to check the blood sugar constantly, because usually for diabetics, depending on several factors, we have a target blood sugar. Target blood sugar implying that there's a certain level where we want your blood sugar to be below or above, because we also don't want it to be too low, right? So we have to continuously monitor your blood sugar. That's why you see it's advised that all diabetics should have their own blood sugar measuring device, which is a glucometer, and that's why it's now becoming more affordable. And when you come to the hospital routinely, we'll have to check your blood pressure, because people with diabetes easily develop high blood pressure as well. That's why you find most people who are diabetic are also hypertensive. So we have to routinely check your blood pressure. Now, we talked about developing complications of diabetes, right? Because usually the problem is not just the fact that there's more sugar in my blood that is necessary. The problem is that this increased sugar in your blood begins to cause problems in your body organs. For example, in your eyes, so we need to do routine eye exams. For example, in the vessels in your legs, so we need to do routine foot exams. The blood vessels in your cardiovascular system, right, in your heart and all of that, so we need to do routine heart exams. Also, generally, because it destroys your blood vessels, it's important for us to check your kidneys and to check your lipid profile frequently.
This is absolutely very necessary, and of course to help us be able to prevent complications, which we would not like to experience such kind of complications, because there are really many, but they can really be very disabling. Like a friend, an elderly friend of mine, just a few months ago got a leg cut because of diabetes. So it's usually very sad, and if we are not doing this kind of ongoing follow-up, it can really lead to a lot of bad results, and it can affect a lot of families. We don't want our families to suffer. So I don't know if you have other things you would want our audience to know as far as maybe these avoiding these complications again are concerned.
Yeah, so majorly when it comes to avoiding these complications, it's really about managing the diabetes as best as we can. And again, like we said earlier, diabetes is a major cause of blindness, right? So how would we avoid this blindness? Like I said earlier, we need to do our routine eye exams. That's why you need to be followed up in a diabetic clinic, because even though it may seem like a lot of work, the diabetic clinics or the doctors who are usually in charge of managing patients with diabetes have a formula, or let's just say a protocol that they follow to make it easy for the patients, right? So if you're coming, normally you should visit the hospital at least every month, right? And every month we'll check your blood pressure. But then we don't need to do all these tests every month. For something like HbA1c, which is a summary of what your blood sugar has been like over 3 months, we would like to measure it every 3 months for a new diabetic patient. But then when your HbA1c is at the target level, we can reduce the frequency, and then we only measure it like every 6 months. And the reason why we are measuring it is because if it's not at the target, then we know that we need to be more aggressive with the treatment. Because if we leave it high, then we'll begin to increase the risk of complications. Now, things like urine tests, we like to check your urine as frequently as possible, because the first sign of kidney disease, which is one of the main complications of diabetes, is that you begin to see protein in your urine. So urine test is a very easy test to do, right? So if you can frequently check your urine and then easily identify when you're beginning to develop kidney disease, it's really good for us, because there's actually treatment that can help to prevent the progression of kidney disease in diabetic patients. And of course, if we see that your urine is beginning to show proteins, then we'll have to go further and test your kidneys. We need to check electrolytes, we need to check your kidney, the kidney function with some other blood tests. Another thing that we'll talk about is like people with diabetes are at risk of developing myocardial infection and other heart diseases. And what adds to this risk is the fact that when your blood vessels get destroyed in diabetes, there's a risk of lipid accumulating in the blood vessels. So if you're diabetic and you have just a slight increase of body fat, or if you have just a slight increase of excessive fat lipids in your blood, you're at higher risk of developing atherosclerosis, which is like a blockage in your blood vessels. That's why you see us routinely checking your lipid level, because once it's detected that you have more lipid in your body than normal, we become more aggressive with your nutrition, we become more aggressive with treating it, because there's also medication that we can give to help to treat too much fat in the blood, because we definitely don't want you to develop a heart attack and things like that. Now, you mentioned a friend who developed an amputation, which is really sad, because that could have been prevented. That's why we do routine foot care in patients with diabetes. It's unfortunate that people with diabetes, when they get wounds, especially people whose diabetes is not adequately controlled, the wound doesn't heal as quickly in a normal way like a wound would heal in a normal person, right? So many times we'll even have a wound and not even know it. That's why when you come to the diabetic clinic, we need to check your feet. We need to check if there are tiny wounds there that you may have missed, because once you get a tiny wound as a diabetic, it can easily progress, and the limb becomes one that they have to amputate. Things like peripheral artery disease, where the blood vessels in your legs get blocked, such that the most distal part of your leg is not able to feel when they touch it, and it also contributes to the reason why wounds take longer to heal in diabetic patients. So we need to routinely check all those things, do eye exams, because diabetes again is a major cause of blindness. So why not just routinely check your eyes instead of let it progress to blindness? You can imagine what it means for you to lose your sight. Yeah.
Thank you so much, and I think you have mentioned a lot around this particular non-communicable disease, and one of the very important things about it is the fact that it can develop other complications in other systems, including the cardiovascular systems. And we know that in our quest to reduce the morbidity and mortality from these non-communicable diseases, it doesn't stop the fact that some of the patients will still rush to our hospitals in emergencies. And I think that before we're ending this session, we are already thinking that in our next session, we'll be inviting you to talk to us about kind of diabetic emergencies. So we want to end this session here, except you have something else to add.
Not really, thank you.
Okay.
I look forward to discussing the diabetic emergencies because it's actually a major problem as well.
Okay, thank you for coming, and thank you to everyone for listening, and we look forward to meeting you in our next session, which is going to be talking about the diabetic emergencies. Thank you.